The GMOA launched this trade union action yesterday morning, refusing to write prescriptions for medicines that patients must purchase outside government hospitals. Doctors alleged that the latest budget failed to address their concerns, prompting them to resort to this measure. In addition to medicines, doctors have now stopped recommending medical tests to be conducted outside hospitals. Today, during a meeting at the party office on Nelum Mawatha Battaramulla, GMOA representatives shared their views with MP Namal Rajapaksa.
When a patient comes to the hospital and we write a prescription, if tears fill up in their eyes and they say, "Sir, I don't have the means to buy these medicines," then we must ask whether the goal of free healthcare is truly being met. The responsibility lies with the Ministry of Health and its officials. The failure of the authorities to take timely action has led to innocent patients facing these hardships.
The GMOA's remarks today came against the backdrop of President's assurance yesterday that their demands would be considered in the future. Currently, patients are under severe strain as doctors refuse to prescribe medicines and recommend tests that are unavailable within hospitals.
මෙහෙම පීඩාවට පත් වෙන්න නම් හොඳ නෑ මිනිස්සු. සාමාන්‍ය මිනිස්සු නේ මෙතෙන්ට එන්නේ වෙන තැනකට යන්න බෑනේ සල්ලි තියෙන අය වගේ නෙවෙයිනේ.
බලාගෙන යනකොට එළියෙන් කරන දේවල් හරි ප්‍රසන්න නෑ කියන එක තමයි මට නම් කියන්න තියෙන්නේ. බලධාරීන්ට කියන්නේ කොහොම හරි මේ ප්‍රශ්නේ විසඳලා විහෙරෙලා ජනතාවට සෙසක් කරලා දෙන්න කියලා වෙලා.
At today's cabinet briefing, the Minister of Health also clarified the government's position regarding the demands of the Government Medical Officers Association.
We inherited a country that was not overflowing with resources, but one that had officially declared bankruptcy on the 12th of April 2022. The Ministry of Health in particular was left with partially constructed buildings and limited facilities. Therefore, providing these resources will take some time. In line with the economic recovery, we will offer every possible facility to retain professionals in the country. We have already issued permits earlier, but even with permits, importing vehicles was not feasible. Moving forward, we will provide all possible benefits step by step. For instance, we granted a salary increase last April. As Health Minister, I am ready to engage in discussions with them and set timelines for these measures. That's why I believe this trade union action will end soon, because ultimately it is our vulnerable patients who suffer the most.
රෝගීන්